Hello, my name is Cate Nimanya, and I work with Water for People as a country director in Uganda. I'm here to share experiences on the role of stakeholder coordination in addressing emerging wash problems, a case of Kamwenge District local government, and how they've been able to respond to COVID-19 pandemic. Water for People is an international NGO with headquarters in Denver, Colorado, and field offices in 9 countries. Our mission is to bring clean water and sanitation solutions to communities for generations to come. In our approach, we partner with local governments, businesses, and individuals, providing the support they need. Institutional arrangements is one of the challenges for sustainability, but which has ended up being a plus in this particular context. Kamwenge District, which is one of the over 100 district local governments in Uganda, has a population of 286,000 people. It is also host to a number of refugees. With only 18 healthcare facilities, of which one is a hospital, the COVID-19 pandemic brought in a lot of challenges. The country came up with policy guidelines that have since been eased since June 1st. Today, we have 1,013 cases with no deaths and over 950 that have recovered. Regarding WASH, a number of stakeholders do work in the districts, ranging from government workers, wash service providers, as well as NGOs and private sector. As Water for People, our support has been mainly to strengthen their capacity to deliver on their mandates. We've built the capacity of service providers in the district to be able to deliver efficient wash services through developing appropriate business models. We have also delivered technical trainings to the Hand Pump Mechanics Association in partnership with the district local government, as well as the community trainings at the local level on water source protection, and so quite a number of other activities. Therefore, at the onset of the lockdown, a multi-sector task force, including implementing partners, heads of departments at the district, that is health, education, community-based services, open wealth creation, security personnel. A number of these actors came together to give direction on how to manage the whole pandemic. The task force had about 25 members, and these members hold meetings every Thursday of the week, and they've done this since April 2020. The task force has a number of responsibilities, of which resource mobilization is one of them, and undertaking surveillance and ensuring that healthcare facilities are functioning, coordinating with the national task force, risk communication and social mobilization, among others. The task force has undertaken a number of interventions. In Uganda, the radio, other than being used to teach school lessons, they've been majorly used to pass on critical information regarding the pandemic. Partners like World Vision, UNICEF contributed greatly towards this. The task force members have also ensured that the presidential directives regarding lockdown and standard operating practices are implemented wherever any community member is. In that photo, you see the district health officer sensitizing the taxi drivers. Other than sensitization, we've had also enforcement being undertaken by the police, especially for those that are non-compliant. We've seen the team ensure that wells are rehabilitated by the Hand Pump Mechanics Association to be able to provide water to the masses. And NGOs like ours, like Water for People, we've also responded by, for example, paying water bills for some of the healthcare facilities. Construction of new water systems has been fast tracked. And in all these, this wouldn't have been possible if we didn't have formalized partnerships already with the district local governments. Imagine coming up with a new partnership with the strike of COVID-19. But we are very lucky. The partnerships they were in existence. The district local government staff were aware of the wash needs since we have a master plan, and there's a whole appreciation that every sector was critical during COVID times, that it's security, transport, work. And if these remain coordinated, then we can actually achieve a lot, even when it comes to WASH. As part of the master plan implementation in Kamwenge, cofunding was already promoted. So even construction of water sources was much easier. Systems like the ones you see here are co-funded even before COVID by Water for People, the utility companies, and the district, meaning that resources are well utilized. There was already an appreciation of washing healthcare facilities arising from interventions by Water for People in all public healthcare facilities. We had hand washing stations in key patient care areas and trade in charges. Thus, COVID-19 pandemic just helped the district and other people to reinforce what was already functioning. Kamwenge also had an active platform where the partners and that various departments could come together, and hence coordination was easy. That is during one of our annual program reflections. This fostered trust and comradeship even in times of COVID. Of course, challenges still remain. Resources are usually not enough. That means we had to get to drop certain activities. Then, of course, the whole issue of non-compliance by the community members, behavior change wasn't easy to come by. Then balancing the response and other emergencies, like we had pregnant women not being able to access medication, non-payment of water bills and user fees was really, really huge. And this affected the businesses of the service providers, but they are managing even amongst those challenges. And vandalism for schools that are actually not fenced. Then none of the health center threes had the capacity to be used as an isolation center. We still have ponds in some of the 16 unserved villages out of the over 300. So this still pose a challenge. What I can say that government has in Uganda has demonstrated a lot of leadership when it comes to coordinating of the COVID-19 efforts. And they should always be left to do that. We should undertake assessments to appreciate the impacts. We know we are really, as a Kamwenge district, they always monitor impacts of the various programs every year. So we encourage even others to continue doing that. Otherwise, you can get a false impression that now everybody washes their hands due to COVID. And then, of course, we need to serve the unserved areas as fast as we can. And then the cross-cutting issues came out quite a lot during this period, and these need to be openly discussed as part of WASH. Capacity building and resource planning on issues to do with COVID should be anchored in ongoing programs. Thank you.